Good afternoon, everyone. Thank you for joining me. This is County Executive Pat Ryan, and this is our COVID update on Thursday today. I cannot believe it is March 4th, but we continue to move through this challenging last year. We're almost to the 1-year mark of our first case in Ulster County, which was March 8th of 2020. And I think each day I feel we're still have a lot of challenges, but each day I really do feel better and more encouraged, especially around the vaccination progress that we're finally making this week. So again, we have a lot more work, but that light at the end of the tunnel that we started talking about in the winter and even before the holidays is getting much closer, and we're really starting to see the results on the ground of more vaccine. So that is encouraging. Diving into the update by the numbers, we crossed another threshold with our cumulative case count now over 11,000 since the beginning of the pandemic at 1186. Total tests 284,000 plus, and thankfully 9329 recovered, and unfortunately, tragically, one additional fatality since our last update on Tuesday, bringing that total to 234 of our loved ones and friends lost to the pandemic so far. Hospitalizations continue to hold at low numbers. We're same as we were 2 days ago, 9 currently hospitalized in the county. And again, we're remain encouraged by what was that very sharp drop you can see on the graph in hospitalizations, and we need to, of course, continue that. Active case count, this is something that we are focused on and a little bit concerned about. We started to see the numbers come down for several weeks, but in the last 48 hours, our active case numbers actually went up a little bit. We're back up to 1523, up about 100 additional active cases. This is mirroring a trend that we're seeing in the entire Mid-Hudson region, and that New York City has also seen, where everybody in those areas are definitely through the worst of the second wave, but on the downslope of that second wave, we've kind of hit a little bit of a plateau. We don't know exactly what's driving that, but we believe it's a combination of folks possibly feeling overly comfortable that things are getting better and maybe letting their guard down a little bit, the possibility of variants playing some role in additional spread, different COVID variants, which we're working to detect with the Wadsworth lab, and just the fact, again, that we've been in this for almost a year. So to me, this is a very important reminder that we have to continue to be vigilant here at the individual level, the family level, and our extended networks that we touch between, friends and colleagues if you're working in person. Once again, the number of active cases right now, even reduced from the peak of the second wave, is higher than the peak of our first wave. So we still have far too many active cases, and we need to continue to do the work to bring that number back down to the levels we were at over the summer. And we're seeing that as well in the new positive test rates, which I'll talk about here now. So in the last 48 hours, once again, we're hovering just below 5% for new positive cases. We are at 4.57%. In the last 48 hours, we've tested 2,513 residents and had 115 new positives out of those tested. So that 4.57% is not a tolerable level, because that very much means we're still at significant risk of spread and possibly seeing those numbers climb back again. So please continue to operate that way, and be very cautious. Even though I know it's beyond getting old at this point, it's just critical that until we can get everybody vaccinated and we get to that herd immunity, that we all continue to follow the precautions and get that number down. Looking at the long-term projection, that's where you can see the consequences of our actions, and that means the difference in just the next few weeks of potentially thousands that either are affected or not based on each of our individual actions. Looking at hospital capacity going forward, we remain in good shape here with 9 currently hospitalized, none in ICU, and more than sufficient capacity going forward. The only way we keep the hospitalizations as low as they are, the fatalities down to 0, is by affecting that new positive rate and the number of active cases, and that all once again comes down to each of our individual decisions to continue to wear masks, to maintain social distance, to continue to avoid those social gatherings, especially indoors, and to continue to wash hands and use hand sanitizer. All 3 of those we know work, and we have to continue to each do those and hold those in our circles accountable as well for those actions. Shifting gears to vaccine process, as I said on Tuesday, I feel more optimistic than I have at any point of the vaccination process that we're finally turning a corner in vaccine supply and vaccine availability. There's still far less than we need and than we would ideally want, but this week, as we announced on Tuesday, we nearly quadrupled our supply here in Ulster County that we're getting from the federal and state government. So this week, we were allocated 7,040 vaccine doses in the county. That's a combination of several different providers, which I'll talk about here in a moment. The breakdown of those vaccines, which is dictated by New York State, you can see on the screen here. This is basically the different categories. Given the high risk to seniors, New York State has directed that the vast predominance of the doses we did get have to be delivered to seniors. So that's, as you can see, almost 90%, 80+% of our doses this week are going to our vulnerable seniors, which is very good news because all the public health data shows that without a doubt, age is the most impactful of the factors that affect those who get the most sick and those who do succumb to COVID. So I think in that regard, given the limited supply, that is generally the right decision. But I also know that there are a large number of folks with other high-risk conditions who also are desperate and wanting vaccines. So I'm continuing to elevate that as well, that we need more for everybody. And I'm asking for a little bit more flexibility in the supply that we do get to balance it across all of those different groups. But the state has directed, again, for this week, that heavy allocation towards our seniors. This is the listing of our county pod sites, which are happening today and have been happening this week, as well as other partners that are running vaccination clinics. Yesterday, we conducted a very effective clinic, several hundred folks vaccinated at Ellenville High School. I want to thank everybody that was a part of that. Today, we are running a 65-plus senior-focused vaccination clinic at the SUNY Ulster campus in Stone Ridge. We'll be vaccinating 1,170 of our seniors age 65-plus. I'll talk a little bit in a moment about the process to sign up and schedule those, but I know there's a little bit of confusion about that. But that clinic today, as directed by New York State, was specifically for seniors and required to be for seniors. So the good news is over 1,000 of our seniors by the end of today will have gotten the vaccine. And then tomorrow at our Kingston High School pod location, we'll be vaccinating 1,496 additional residents. Those will be our 1B category, which are essential workers, including teachers, first responders, and a whole other set of essential workers at high risk. So within the supply we have, we are balancing that. Some of those numbers at the Kingston High School site are second doses, but that's the number of first and second doses that will be administered there tomorrow. All the SUNY Ulster ones are first doses, just to be clear about that. And then on Saturday, we'll run another pod site at Kingston High School at about the same scale. And in addition, throughout the week, those other partners that I mentioned, the Kingston Family Health Center, the 2 Walgreens locations in Kingston and Highland, and the Village Apothecary based out of Woodstock, but vaccinating across the county. All of us are working together to quickly and safely and equitably get those 7,000 plus doses out. And once again, that represents a quadrupling of the previous supply, and we do anticipate that that will continue or even build even more going forward. On that note, more encouraging news, we did receive late yesterday a very small initial allocation of the Johnson & Johnson vaccine, which was just approved over the weekend by the FDA. We'll be getting about 100 doses of that starting tomorrow and just to use for the remainder of this week. And then next week, we're hopeful that we will get more. We are deciding, based on quite a lot of feedback from the community, to prioritize initially those Johnson & Johnson doses specifically for homebound seniors within the community. We have a list of several hundred that our Office for the Aging has already identified through our email and phone call signups. So our homebound seniors, I hear you, and we've heard you that that's a great point of concern for you, and we'll start to do that work, sending out mobile teams with that Johnson & Johnson vaccine. The good part about that is because it is a single dose, it will only require one trip by us for those homebound folks, which will just make the logistical piece of that a little bit easier. So that's why we're specifically using the Johnson & Johnson for the homebound population. As we get more vaccine of all different kinds, we will absolutely continue to ramp up the homebound work. We know that there are hundreds, if not thousands, of folks in that category. If you are in that category as a homebound senior, please, if you haven't already, you can call our Office for the Aging. That is 340-3456, 340-3456. Once again, we don't have enough yet to do all these homebound visits, but make sure you get pre-registered on our list, and then as soon as we have more, we will ramp that up as much as we possibly can. And that is, I think, a really positive development now that we're able to finally do that. Here's a sense, zooming out, of where we're at in the overall vaccination progress for the county. As of this morning at 11 a.m., we have vaccinated 26,915 of our residents have received their first dose, and 13,358 have received both their first and second dose. Everybody, that has gotten the first dose already has their appointment preset and a guaranteed availability for the second dose. So that means that now 15.1% of our Ulster County residents are vaccinated or at least have started that process. And if the supply continues at this rate, that'll allow us to dramatically speed up the very slow trickle that we had estimated before. So if we can get the supply up, that'll let us move much faster. And once again, our distribution capability in the county between our pod sites and our other partners have us in a situation where I feel very confident if we got the supply tomorrow, we could get everybody vaccinated in 1 to 2 months. So as the federal government and the new administration ramp up supply, we are ready to push that out. To that end, myself, other elected leaders in Ulster County and the region have been calling for an Ulster County specific, or at least a Mid-Hudson regional site further north. We had some good news in that regard today, and I want to thank New York State. They are setting up at least a short-term temporary mass vaccination site in Poughkeepsie. This was just announced this morning by the governor. This site will also be using the Johnson & Johnson vaccine that's now available. At this point, we know only that this will run for a few days, and those appointments are through the New York State sign up on the New York State eligibility portal. Because they're in Dutchess County, you have to go there, but that is accessible to anybody in the state, just like the other state sites are. So that's another new source. Once again, it's only we were just told this morning it's only going to run for the next few days, and we're hopeful that continues. So that is good to have that short-term clinic, but I am mindful and will continue to press for our own permanent state and county joint site here in Ulster County at the Kingston High School Fieldhouse, where we have a very smooth operation where we can rapidly scale up. So I'll continue to press on that and follow up on that request that I've made. We are, again, starting to see more overall supply. We're seeing the short-term site, but we need a permanent site here in Ulster County, at least one, and then we can go from there. And I'm going to continue to press on that and ask everybody for their help. Again, want to thank Senator Hinchy, Assemblyman Cahill, our county legislature, everybody joining together to continue to advocate for that site. Finally, wrapping up before I just talk about one other thing, I want to talk about the process from your all's perspective in terms of how you make sure you get pre-registered and ultimately book appointments. As we get more and more vaccine, the good news is more and more people are finally going to be getting an email saying, "Hey, now we have appointments available. You're able to sign up. Here's the link." So the way that works is the first step. If you haven't already, you need to pre-register on our Ulster County webpage. That is at vaccinateulster.com. You fill out a quick form. It takes 1 to 2 minutes. That will put you on the pre-registration list. We've got 30,000 plus folks already on that list, but that gets you a spot on that pre-registration list. If you can't sign up online, you can call via phone. That is 845-443-8888. That's our recovery service center. So 2 options there. Once you're on the pre-registration list, the next thing that you should be watching for is either an email or a phone call if you don't have email access from us saying you're now able to actually sign up because we have available vaccines. So for example, yesterday we sent out several thousand of these emails to individuals that are on our pre-registration list that meet the qualification criteria that have been set. Once you get that, then that'll actually let you go in and actually lock in an appointment at a specific time at a specific location. So that's how it will work. One thing that I do want to flag, and I ask everybody's help in communicating this, if you receive that email from us saying you're now eligible, here's a link, you'll also notice that in that email it says, please do not forward this email to others or share it with others. And I know that that's hard because we all want to help each other out. But what's been happening is eligible folks have gotten that email and then they've shared it with others. Those others who are not eligible have been signing up for appointments and then getting their appointments canceled because they're not able to get the vaccine. So that's extremely frustrating, I know, and we've gotten some calls about that. So please, if you're getting a link, please use it for yourself. You got it for a reason based on the information you provided. Please don't share that with others because, frankly, it throws the whole system off and actually makes it harder for everybody and frustrating for those that think they're signing up and then are told that they can't. So please keep that in mind and read that email fully. And the good news is, again, more and more people are going to be getting this. And we're going to continue to push to get the supply up as quickly as we can. I know that every single one of us, for ourselves and probably more so for our loved ones and our vulnerable loved ones, want this right now, this minute, and I, believe me, I get that. But unfortunately, that's just not where we're at yet with supply, so we have to continue to be patient. We have to think about prioritizing those at greatest risk. And that's what the state has done, and that's the guidelines that we're following here. So I appreciate your patience with that. I know it's been tough, and we're going to keep just kind of pushing through this as best we possibly can. Shifting gears and talking about how we come through this, I do want to share a really exciting update about some of our recovery plans, especially as it relates to housing. And I've really been talking about this from the beginning of the pandemic. We knew even pre-COVID that we were at a crisis level of housing affordability, with more than half of our residents spending far too much of their income on housing just to afford a decent place to live, making it impossible to meet other needs. And that has only gotten significantly worse due to the economic impacts of COVID. So we're in a situation now here in the county and really across the country where frontline workers who for the last year or more now have been risking their lives for us, whether that's a nurse, a teacher, a grocery store clerk, a delivery worker, and so many more, risking their lives for us, but unable to afford a reasonable and decent place to live right in the same area that they're risking their lives for. And that is just wrong on every level. So we've been taking up this work to make sure that that is not the case, that if you've put it on the line for our community, we're going to have your back, not just by thanking you with words, but making sure that you're paid fairly and that you can have a good place to live right here in our community. So to that end, today we are releasing an extensive housing action plan for Ulster County. And we've been working on this for several months now. Many folks involved in this, from our legislature, working with a leading think tank in the area that are experts on the housing crisis, working with a whole host of stakeholders and leaders across the community, not just to diagnose the problem, which we know is really bad, but to have detailed data about town by town, how the challenges have played out, how difficult the situation is for so many, and most importantly, to lay out specific action steps to address the crisis that we're in, especially as we come out of the pandemic. So the Housing Action Plan will be publicly available to everybody today. We'll be sharing that on our website. We'll share it on social media. We'll be sharing it with the press and anybody who wants to take a look at that. It's an extensive 141-page report with a lot of data, but also, again, concrete steps. At the high level, there are 5 major recommendations for action. I'm not going to go too deep into these because I know most of you are primarily tuning in, I think, for the COVID update, but I think this is all interconnected and really important. Number one, we're establishing a county-wide housing task force because this really is a community-wide problem that we all need to be bought in on. We're going to work much more aggressively with community leaders, elected leaders, and housing builders to have a coherent strategy, not just to build housing in the way that many of us have seen in the past, but to do what's called scattered site redevelopment, which doesn't build huge mega projects everywhere, but actually builds communities and integrates new housing where it makes sense in a thoughtful way, in a well-designed way that's a net positive. And it also reuses existing locations that might be able to be upgraded or are currently in bad shape and redevelops them. The third recommendation is to increase specifically more housing for folks that need supportive and transitional services in addition to a place to live, to have some other supports, whether that's addiction recovery, mental health help with employment, or any developmental disabilities or other challenges that folks have. So to think about housing as the starting point, but to add other supports as well. Fourth, we're replicating the really successful Climate Smart program in New York State, which Ulster County has been really a leader in. We're creating a similar Housing Smart communities program in Ulster County, the first time that this has been done, where communities and towns can opt in, and several towns have already expressed excitement about this in calls that we've had with mayors and supervisors in the last few weeks, where towns will have resources and support from the county to meet a set of specific goals that will put those towns and villages and cities on a path to addressing the housing challenges and the housing affordability challenges that so many are feeling. And then fifth, all of this takes money and resources, of course. So the report also calls for us to establish one or more funds within the county dedicated specifically to addressing housing-related issues, whether that's actually building housing or making investments in other infrastructure, water, sewer, other infrastructure needs that infrastructure investments that will make it easier to build more housing, whether those are single-family homes or otherwise. So for those of you focused on this issue, which I know many are, and experiencing those challenges, know that we're really engaged on this, everybody at all levels, and please do check out that report. One of the specific and most exciting pieces that we're doing as a county to show and lead by example, which we've talked a little bit about already, is knocking down our old county jail on the Golden Hill site in Kingston and building workforce and senior housing, a real, again, community on the top of that beautiful piece of land that used to be used to incarcerate people, and now in the coming years will be used to provide great home and community for seniors and working people and families throughout the county. So that will continue this year, and that's one example of what we want to see more of happening throughout the county. And this report really, again, lays out that action plan to do that work. So if you want to get involved, please check out that report. Please reach out to us. And we're excited to be doing that to really help drive us successfully out of the pandemic in a better way. Thank you for tuning in for the COVID update, and also hopefully staying on to hear about our housing work. Thank you for continuing to stick together in really challenging times. I especially want to, as always, thank our frontline workers still out there taking great risk to themselves and their families to keep our community, to keep our county running. We thank you for what you've done and what you're doing. Our next update will be next Tuesday, 3 p.m. In the meantime, if you need anything, you can call our Recovery Service Center, and make sure that as we head into this weekend, you stay safe, remain healthy, remain resilient, and we'll see you in a few days. Thank you.